Is it time to do a clinical audit? What are the benefits of this process? With good clinical audits, you can make more happy patients, learn in teams, set higher standards in your practice, help anticipate future risks, contribute to your professional development, and support accreditations annually. So how do you make sure your audit is successful? We've broken down the audit cycle into smaller steps with some useful tips to help you with your process. First, you choose your topic. How do you know if your question is relevant? With many directions available, choosing a topic can be very overwhelming. If your patients or colleagues have raised any concerns recently, it might be a good direction to go into. We highly recommend involving your colleagues from the start. Doing a clinical audit is supposed to be a very humbling experience. Choose a topic which is relevant to your practice and can make a difference. And make sure to identify resources already available to you, such as relevant guidelines and findings. Once you have carefully chosen your topic, it is time to think about what you want to achieve. Set a standard by setting quality goals. When defining your criteria, make sure it is evidence-based and you refer to literature indicating rcgp, NICE, SIGN, or other accredited guidelines. After you set a standard, find out whether your practice meets it by collecting patient information. Types of data can be computerized records or through manual collection. Identify who needs to collect what data and how. You can use the NICE data collection sheet for this. As data collection can be the most time-consuming step of this process, only collect information that is absolutely essential. Next, compare collected data to previously set standard and discuss findings with the team. If standards were not met, that's good news because it means you have chosen your topic carefully and that there's space to improve. Note down all known reasons for why the standard was not met. Summarize all outcomes and present the results in a team meeting. Develop an action plan with the help of the NICE action plan template, mapping out what has to be done, how, and by when. Once the change has been implemented, it is time to wait. Leave enough time for the changes to come to effect before re-auditing. This is essential for correct results to come back. Depending on your chosen topic and implemented changes, waiting time can last from 2 weeks to 6 months. After this time has passed, you are ready to re-audit. Re-auditing is just as important as doing the first cycle. Taking a second cycle will show if the implemented change has made a difference and provide direction for next steps to take. Collect new data, compare to set standards. If they were met, set new standards, and finally, develop a new action plan. You are encouraged to refer back to tips we have shared for the first cycle. The clinical audit can go on for as long as you like, but a minimum of 2 cycles are necessary to receive fair results. And whenever you need motivation to keep going, remember the value of good audits. A successful audit will give you many benefits, such as happy patients, learning in teams, setting a higher standard, anticipating future risks, contributing to your professional development, and supporting accreditations.